Can an educational intervention improve healthcare provider confidence in diagnosing adult ADHD? My name is Pamela Matthews. I'm a DNP student, PMHNP BC at Regis College. The purpose of the scholarly project is to investigate whether an educational intervention can increase healthcare provider confidence in diagnosing adult ADHD. The scholarly project examines healthcare provider confidence levels. The project participants include all healthcare providers over 18 years of age and up to 70 years of age who diagnose adult ADHD in clinical settings. This includes primary care doctors, APRNs, psychiatrists, PMHNPs, LMHCs, and clinical social workers and psychologists. Data collection. A convenience sample at an outpatient clinic in the northeastern part of Massachusetts. Participants were sent invitation flyers via email. Participants scanned a QR code using the Qualtrics XM platform. Participants completed an informed consent. Participants completed a demographic survey. Participants completed a pre-test, post-test C-scale confidence test by Susan B. Grundy. Participants watched a PowerPoint educational intervention on diagnosing adult ADHD. After watching the educational intervention, participants completed the C-scale confidence post-test. Intervention. The educational intervention is a 15-minute PowerPoint video that details how to recognize and diagnose adult ADHD in clinical settings using tools and guidelines. Theoretical framework. Discussions on Benner's theory of novice to expert. Patricia Benner's novice to expert theory describes how healthcare providers develop clinical expertise through practice experiences progressing through 5 clear-cut stages: novice, advanced beginner, competent, proficient, and expert. The Benner's theory of novice to expert theoretical framework was selected for the scholarly project as it focuses on healthcare providers acquire clinical knowledge to build on clinical experiences to increase confidence and expertise in the diagnosis of adult ADHD. Evidence-based practice model. The evidence-based practice model guides the project using 5 stages: STAR, discovery and research; STAR 2, evidence summary; STAR 3, translation; STAR 4, practice integration; and STAR 5, progress, evaluation, and outcomes. Using the 5 steps of the STAR model, the PI starts a preliminary investigation over the topic of interest. Then a systematic review of literature is followed by a summary of findings. During STAR 3, the PI focuses on summarizing the findings from the literature. It is during this phase that the PI establishes recommendations for the clinical practice. STAR 4, the PI will then review the findings with interprofessional and interprofessional teams, including the chair and statistician. Results of the project will then be disseminated. The PI with the team note if the educational intervention used in the project has shown to be beneficial in improving healthcare provider confidence in diagnosing adult ADHD. This is the integration of practice during this phase of the project. The last STAR will evaluate the impact of the educational intervention on patient outcomes moving forward to ensure that the project is sustainable. Measurable outcomes. A quantitative design for pre-test and post-test was used. Demographic variables are used to summarize descriptive statistics, including mean, standard deviation, frequencies, and percentages. The project examines changes in confidence scores using C-scales between pre-test and post-test, before and after watching an educational intervention. Paired t-tests will be conducted. Prior to testing a paired t-test, assumption of normality will be tested using the Shapiro-Wilk test for different scores. Thank you.